said, oh, you just, I think, press that button to forward slides, but that's okay. You'll put my presentation up, I'm assuming.
I assume so too. Okay, good morning, everybody. I'd just like to introduce Judith Glasner, our first speaker. Judith has worked at Melbourne's Royal Children's Hospital for over 30 years, joining the CF team in 1991. Judith completed her PhD on the impact CF has on siblings and has spoken nationally and internationally about her research. I'd like to welcome Judith Glasner to the stage.
Thanks, Leanne, and thank you, everyone. Lovely to be here today. I thought I'd just start by talking a little bit about my CF journey. Chris Thompson, who's in the room, did a beautiful job speaking to the medical program on Friday, and I could relate to so much that he talked about in terms of how much CF has changed. So in 1991, when I first started on the CF team, there was one dietitian, one physio, and I was the nurse who was to cover psychosocial as well. And in that year, we had 32 newly diagnosed babies and we had 11 deaths. And that was what CF was like. And I found myself running from a new family, trying to have some optimism and hope, with the reality that, a lot of young people were facing, the end stage of their condition. The mantra for young people was not here for a long time, here for a good time. So education just wasn't a priority. Cough and early chronic infection were the norm. So, it was just a given that you were going to get Pseudomonas and you'd have lots of time in hospital. There were CF camps, yes there were. There were 6-bed rooms on the wards, and young people, I remember Chris saying, would often ring and find out who was in to, coordinate their tune-ups together. And they did physiotherapy together. There was really just a one-size-fits-all approach to treatment, and newborn screening had only just started. So the families I were meeting had children clinically diagnosed, and often more than one child at a time. So contrast that to 2024. So now the wonderful thing to say, and especially when I meet new families, is that a death in the paediatric setting is a rarity. There's regular surveillance and aggressive treatment of infections, individualised treatment plans. We've got expanded MDTs, so we have a wellbeing team that consists of a social worker and 2 psychologists who are one full-time EFT, so 4 days a week and 1 day a week. There's a lot of emphasis on preparation for transition, but I still think this is something we can do better and earlier, especially given the importance of all of the monitoring that goes on in adult care these days with the new complications of CF. Improved treatments have led to an improved outcome. We've got the Australian CF Data Registry that helps us with quality improvement projects and highly effective modulator therapies. And the benefits include reduced hospitalisations and improved life expectancy. And this has all brought new challenges with increased survival. So I think really important to say that while there's an incredible buzz at the conference and all of these wonderful new therapies, not everyone's eligible or responsive. And some people with CF have had to cease these therapies due to complications. Other people have started them later in life and so still have some irreversible disease. So we're not talking about a homogeneous group here. We don't know the implications of long-term use. And Leanne Tremmell, we were just talking outside, ran an amazing fundraiser a week ago, and there was one of my patients actually spoke, and it was just a reminder to me that there are still a lot of challenges and CF still remains incurable. So I'm not wanting to be Debbie Downer at all, but I just think we need to be realistic as well. And I think because of all these changes, the impact on siblings is changing, but it's not a level playing field by any means. So, my interest in siblings. As Leanne said, for over 30 years I've had the privilege of working with children with cystic fibrosis. And when I first started in my role, I quickly realised that I was working with the family system, including other members of the family, who were also impacted by this demanding, incurable disease. As you well know, the daily treatment regimen requires a high level of parental involvement from infancy, childhood, adolescence, and even through to adulthood. The demands CF care places on parents raises the question of how time and attention is allocated when there are other healthy siblings in the family. So I often found myself over the years in conversations with distressed parents who were concerned about the focus on and time spent on treatments with their child with CF and the guilt they felt about it potentially having a negative impact on their other children. When I searched for resources and information about the impact of chronic illness, and specifically CF, on siblings, I found a paucity of research, let alone any Australian research. There was, however, a person by the name of Kate Strome who was championing siblings of people with chronic conditions, but it wasn't CF specific. The improving outlook for people with CF means that the sibling relationship is more important than ever before. But there was very little research about young children and adolescents with a sibling with CF and almost no research about adult siblings. And that's pretty much true to this day. So what did I do? I decided to embark on a PhD to better understand the experience of CF from the perspective of siblings. But I'll tell you a little bit more about that later. Being an only child myself makes it hard to relate to sibling issues, so maybe that's why I'm so interested in this topic as well. In 2018, CF Australia conducted a survey of siblings of children and adults with CF to find out about their experiences. So in that survey, 83 people completed it, and they were siblings aged 13 and over. And of that sample, 79% were females and 21% were males. Almost 68% of siblings worried most or all of the time about their brother or sister with CF, and just under 50% had never spoken to a health professional. These were some of the challenges mentioned in 2018 and I'm sure are still existent for many, many siblings today. So being on an emotional roller coaster, feeling lonely, just worried about the loss of their brother or sister, and really happiness based on the health of their brother or sister. And the positives, and this came out in my research as well, was just how inspiring their brothers and sisters were, that they had very strong relationships and realised that life was precious. It gave them a really unique perspective on life. And I think just an increased compassion and understanding about people with health challenges and empathy. And not surprisingly, a lot of siblings go into the healthcare professions. So I'll tell you a little bit about my research, but I think it's really important to contextualise it that I completed my PhD in 2018. So my data was collected prior to modulators being available. So I think there are still some relevance, but I want to sort of talk at the end about where I think we need to go. So my research assessed the difference in parental differential treatment in two types of families: those with a well child and a child with CF, and those with two healthy children. In addition, I looked at the quality of the sibling relationship and the social and emotional adjustment of well siblings in families caring for a child with CF. I had 79 families who participated in the study, and I won't try to summarise my methodologies, but a major strength of my study was the participants of fathers, whose contribution to family life is often neglected in family studies involving children with chronic health conditions. So at the qualitative level, I asked the siblings 4 questions, and these were questions I heard someone talk about at a conference, so I asked the same questions. So they were, what happens to you when your sibling goes into hospital? What are 3 good things about having a sibling with CF? What are the 3 things that make it difficult? And what would make things better or easier for you? As expected, the responses of these siblings differed greatly according to their age and maturity. Not surprisingly, the daily routines of well siblings were disrupted by the hospitalisations of the sibling with CF. Although some well siblings found the change in arrangements a fun or positive experience, such as staying with friends or relatives. But for many, and especially with increasing age, it was a negative one. Siblings regularly commented about feeling left out or being shipped off to other people. As predicted, concrete rewards such as special family holidays and special experiences through wish-granting organisations were the most commonly cited advantages of having a sibling with CF in the younger age groups. As siblings grow older, greater cognitive maturity results in the potential for siblings to gain enhanced appreciation of and empathy for the needs of people with CF. And this was especially notable for the 14 to 16-year-olds in my study. The most frequently cited challenges about having a sibling with CF reflected the difficulty for siblings to commit to extracurricular activities because of the unpredictable nature of CF. Several siblings talked about not knowing what the day would bring and whether they would come home from school to find out that their sibling required an admission to hospital, and the whole family routine would be disrupted. Regularly being late for school due to the demands of before-school CF treatments was another common theme. One area of concern related to the worry that healthy siblings had about passing on a cold, even at a young age. Another child was highly anxious about the risk of death for their sibling, which was quite inconsistent with the health of their brother, of that person's brother at the time. These concerns suggested the presence of underlying anxieties and fears about the health of their sibling with CF. Interestingly, different parental behaviours were explicitly articulated as a disadvantage, but only by older siblings. And perhaps this is less able to be expressed by the younger children, whose behaviour may better reflect their concerns, such as increasing demands on parents at the time of CF treatments. Some siblings acknowledged that their sibling with CF got more time and attention from their parents, but said things like, "I know it has to be like this." These comments were often tinged with remorse for expressing the inequality that they experienced or perceived. Parental differential treatment was assessed using daily phone diaries over 3 different days. And this software was developed by one of my supervisors, Dr. Alexandra Quitner, who will be known to many of you in this room. Phone diaries were completed by mothers and fathers for the same 24-hour period for 3 separate days. And the phone diaries asked, what activities were you engaged in, how long were you engaged in those activities, and who were you with during those activities. And in my research, I found evidence of parental differential treatment for fathers, but not for mothers. So interestingly, I found that fathers were spending more time with the younger child who had CF than with the older, healthy sibling. And high levels of fathers' differential treatment were consistently associated with older, healthy siblings having a perception of parental bias towards their brother or sister with CF. So it was only an association, but I think something that was very interesting and warrants further investigation. So the possible future. So I've talked about parental differential treatment, and during the conference we've talked about teams thinking about some of the treatments that we might be able to reduce, including potentially reducing clinic visits for some of our patients. And we've talked about how there's some anxiety with parents about doing that, but that a lot of people with CF are voting with their feet and dropping treatments already because they're feeling so much better. So we're really trying to pivot very quickly, but we haven't got a lot of knowledge to base these changes on at the moment. But I think as the burden of CF reduces for people living with CF, there will be potentially less parental differential treatment. People with CF are going to outlive their parents, and that was something I never imagined when I started to work in CF. And so what are the implications for siblings as their brothers and sisters grow older? And as they do get potentially complications with CF as older people with CF, what is the role of siblings as their support and caregivers potentially? New therapies continue to be developed, such as gene therapy. I think there's still a lot of hope for that, and modulators for rarer CFTR mutations. So hopefully CF becomes a chronic condition with a normal life expectancy. So in conclusion, I think as the outlook for people with CF improves, we need contemporary research to understand the changing impact of CF on families, especially the siblings. We can't forget the siblings. And I think it's really important to temper things. There's a lot of optimism. As I said, I couldn't believe I'd be sort of living through this period of advancement in CF. But there's still a long way to go, and this is not everyone's reality. I'd just like to acknowledge the photos that I've shown during my presentation are actually of two people who have taught me a lot about siblings, and they're my two daughters. And I use these photos because they were taken by a very talented photographer, Alexandrina Parker, who is a photographer and a mother living with CF. Thank you very much.
Thank you, Judith. I'd now like to welcome Holly Edwards-Smith to the stage via Zoom, though. Holly's a 25-year-old journalist from Perth who's currently living in Melbourne, and Holly's older brother, Blake, had CF. So CF Australia remains a charity very close to her heart. I'd like to welcome Holly.
Having siblings can be a bit of a roller coaster growing up. It's easy to look at other families and compare yours to theirs, often wanting what we don't have. And for me, growing up with 4 older brothers, that meant at times I did long for a sister. I dreamt of playing dolls and sharing clothes, but instead was treated like a WWE ragdoll, and was often on the receiving end of choke slams, being involved in wrestling manoeuvres in practice, and something that our family called the claw, which was effectively an intense tickle monster, which was actually a lot more uncomfortable than it sounds. So looking back, while I'm sure if I did have sisters, I would have been able to play dolls, I think I'll take the wrestling over what my friends with sisters describe as psychological warfare, because to be honest, I'm not sure I could have withstood that. And of course, as with any situation and any family dynamic, there are ups and downs and pros and cons, but I think reflecting on those downs, i.e. the wrestling, I've realised that many of them are actually some form of affection. Like my brothers acting like 3rd, 4th or 5th parents was really them just trying to protect me, and that even the wrestling perhaps was them trying to show me some form of affection or spend extra time with me. Now, when I began writing this speech, I had a bit of a mind block and took to trusty Google for some creative inspiration. And at first that involved looking up the definition of a sibling, hoping it might offer some poetic definition and description. But it simply says a brother or a sister, which didn't really get the creative juices flowing too much. So then I looked at phrases and poems that are about siblings, and I did found something that I thought was a lot more meaningful. It's by author Clara Ortega, and she writes, "To the outside world we all grow old, but not to brothers and sisters. We know each other as we always were. We know each other's hearts, we share private family jokes, We remember family feuds and secrets, family griefs and joys. We live outside the touch of time. So I'll take the time now to introduce myself. I'm Holly Edwards-Smith, I'm 25 years old, and it's my absolute pleasure to be addressing you as part of this conference and for this session, A Sibling Perspective. I do send my apologies that I'm unable to be there in person. That will be explained later on in this speech, but I would like to take a second to truly say how grateful and privileged I am to have this platform today, to have been asked to speak and to be involved in this special weekend, and to have been also involved in the lay committee that assisted in organising it. And I want to thank everyone part of CF Australia, small and large, no matter how big their involvement is, because it's going to be an absolutely ripping weekend, and I do truly wish that things were different and I could have been there. But to offer some background about me and my family, as you could probably tell by now, I had 4 older brothers growing up, and we were a big blended family. My mum and dad had actually each had 2 sons in previous relationships, and they got together later in life in their 30s, ready for the boys to start leaving the nest and perhaps fully start their lives as parents after being really involved for a number of years. But fortunately for me, that plan didn't work out. And when my brothers were 8, 12, 14 and 16, they welcomed their first baby sister, yours truly. And it was a very interesting experience growing up with 4 older brothers. But something else that made our family unique was that one of them had cystic fibrosis. And for lack of better resources, I'll just show you on my phone here. This was the family before I was born, my mum and dad and the 4 boys. And this one here was Blake, or Buddy as I called him growing up, because I had a bit of trouble saying Blake, and he is the one who had cystic fibrosis. Now, there was a big age gap between Blake and I. He was 16 when I was born, so really all my memories of him are when he's in his early 20s. This is a photo of us when I was about 2, and he was probably 18, edging on 19. And now, that age gap meant that I didn't really see or have to experience alongside Blake the roller coaster that is cystic fibrosis. By the time I knew him and met him, he was pretty much taking care of himself. He knew the ins and outs of his body and his treatment, and he handled his physio and medication. Things I do remember are him sometimes walking around the house with an oxygen tank. I also remember him teaching me how to use his nebulizer with Asmol and that distinctive cough, of course, to get up all that nasty phlegm, which he would often cough into a little plastic cup that he walked around with, which would probably sound pretty disgusting for anyone not involved in cystic fibrosis, but for those that are, I guess it's one of those things that, like, if you know, you know. But also in preparation of writing this speech, I actually felt a little bit of guilt in a way, because I didn't grow up experiencing cystic fibrosis alongside Blake. I felt that perhaps my input as a sibling and my perspective wasn't as valuable. I know that that's not the case, and that every journey is unique, and that every perspective is valuable and worthwhile. And so rather than try and delve into memories that are a bit blurry, instead I'd like to share with you a little bit about my wonderful brother. So Blake CF gene was Delta F508-6211, and by all accounts it was a nasty one. He did spend a lot of time in hospital growing up, and it meant that he often did have setbacks which would limit what he was able to do, but it certainly never limited his dedication to try these things, and it never ever impacted his positivity about life. It actually probably fueled a fire that was Blake. I describe him as the brightest light in every room, and I think that's something that many people with cystic fibrosis share. They often are the most joyful, happy, incredible people that we are lucky to meet and spend time with. But because Blake knew that his time was short, he lived life fully with that in mind. He loved hard, He travelled. In fact, I've got some more photos of him being a little bit of a goofball in New York. This is him with his mum and his best friend Claire and her mum when they were in New York as well. So he certainly tried to make the most of what he knew was going to be a pretty short life. And it's that positivity, that's something I've tried to take with me. Blake died 2 months before his 25th birthday on May 20, 2007. And it's a day that remains burnt into my mind, as well as those in my family and those that love and knew Blake. I think particularly having passed that age now, it really cements how short his life was and how tragic his death is, but of course how tragic many people's deaths, many people's with CF deaths are, particularly before drugs or can be, and now Trikafta, which are able to extend their life. I think in part of this speech and reflecting on our time together, the bits that pain me the most are the fact that despite having a sibling being something that's, going back to that poem, outside the touch of time, grief certainly isn't, but memories kind of are. And I don't remember what his voice sounds like or what his laugh was like, and I'll never get to know what our relationship would have been like as adults. But it is those incredible traits and attributes of his, that unwavering strength and determination to move past anything that life threw at him, that are things that I've taken from knowing Blake, and I think many people who knew him have taken from him as well. It's part of the reason that I'm not able to be there in person, and why I might be a little bit sweaty filming this video off an iPad in Montenegro. Blake's desire to travel and see the world and do more, and spend less time behind a desk or doing mundane things, inspired me to quit my job and do this. And it's been incredible so far, but I truly am sad that I'm unable to be there in person. But again, it's something that I've taken from him and something that I'm truly grateful for. Blake had such a big group of friends growing up, and all of them would describe him the same: loving, kind, compassionate. Again, he truly was the brightest light in any room. So at the start, I said we often compare our families to others, and perhaps maybe it doesn't always feel really lucky to have the siblings we are or be born into the situation we are, but I feel incredibly lucky to have known Blake. I feel incredibly lucky to take the little silver linings from his life that I can. Of course, in the hellish black pit that is losing a sibling, I would trade all of those silver linings to have him back, but that's not how life works. So all we can do is take those little joys and those little bits of happiness that our siblings with CF provide us and keep moving forward. And I just try and live for him and in light of him, and try and be as much like him as I can. And I also feel very lucky that I've been introduced to this wonderful community, and that as a journalist I've been able to cover stories about cystic fibrosis and the approval of Trikafta, and meet other wonderful people with CF, and be part of the Lay Committee and be speaking with you today. So for that, I'm incredibly grateful, and I hope that this has been a good speech. So thank you so much for the time today, and that's all from me. Thank you.
Thanks so much, Holly, for sharing yours and Blake's story. We could all feel your sentiments about how much he meant to you and how much he still continues to mean to you in guiding what you're doing as well. I'd like to now welcome up Daniel Matthews.
Hi, I'm Daniel Matthews, and I am 12 years old with two older siblings with cystic fibrosis. My sister's name is Rachel, and she's 19. My brother Luke is 13. They both have CF. Having a brother and sister with cystic fibrosis has been challenging at times, especially when they are not around all the time due to hospital. When I was younger, I always struggled with a lack of knowledge about CF. This has affected me, as I always thought they were avoiding me all the time. not realizing the things they had to do and had been through. This often made me upset, but now I get it. With more knowledge, it still has been hard, but has certainly been easier. On this journey, I've had highs and lows, but when I felt down or annoyed about my brother and sister having CF, I would often turn to my mum, as throughout my life, she has always been there to help me through the rough times. Throughout this, things have slowly gotten better, with increasing knowledge on the subject as well as new medications helping my siblings along their journey too. Although there are many negatives about having 2 siblings with CF, there are still positives. These range from getting time off school to getting to meet some people in the hospital. I have also enjoyed the activities like Starlight and hospital school, in which I made many memories, but one of the best things is getting some alone time without them annoying me. Although it's been hard, I've been able to get through the tough times and still enjoy life with them by my side, and I wouldn't know what I would do without them.
One on? I'll assume it is, or it is. Thank you so much, Judith, Daniel and Holly, for your presentations this morning. I'd like to open it up to any questions from the audience. Chris.
I shouldn't have gone first because I don't know if I'm capable of speaking after that, but I just really want to say thank you, really. So that's probably all I'll say. I'll go as long as I can, but not very long. But yeah, my brother was born shortly after I was diagnosed, and I think with CF, both for the parents and also the child, you have this understanding that you might not outlive your parents. It's just you're sort of really upsetting the order of things, and I probably didn't expect, and I don't think anyone expected me to outlive my brother. But he really struggled, yeah, so for a lot of the reasons that you talked about, Judith. So.
How did you manage to access the siblings of your children that you're working with? How did you reach them?
I think it's working. Yes, that was, it was basically families from the clinic where I work, and there was a bit of a debate about that because I have obviously a long-term relationship with them, but I think I really wanted to give the siblings a voice, and I think parents were really very supportive of that. Okay. And in terms of how I recruited the comparison families, I actually asked the families in the clinic who agreed to participate, who had children in the age range I was looking at, to nominate another family who weren't relatives but who were like family friends who had children similar ages, and that worked really well. But ideally you do a much bigger study, you know, obviously across centres with a whole age range of siblings, but that's how I recruited, and so I just hope the families didn't feel like they had to say yes because I was asking.
Okay, thank you. And the other thing is, I'm from New Zealand, and I was just telling my colleagues, or asking, if they knew about our parent-to-parent organisation, and if there's something similar in Australia.
There's not, and this is a real deficit, I think. You know, I had a thing up there about family-centred care, but the reality is in hospitals, we deal with the young person, with CF and the parents. And, you know, even doing this research, I didn't know about some of the siblings even existing in the families. So I think, you know, there's a great need for support programs, just things, as Daniel said, you know, places where siblings can go, getting to know the siblings, making them part of the it's not just the young person with CF coming into clinic, but getting to know about the brothers and sisters and their interests and including them. They're little things, but I think they mean a lot. And Kate Strome from Siblings Australia, who I don't think is working for them anymore, but I think the organisation continues. There are some resources on their website, but not CF-specific ones. But I'd really love to do something like at the Children's Hospital in Melbourne, we have the Chronic Illness Peer Support Program. I'd love there to be something for siblings across conditions, but I think there's a lot of similar issues, different but similar. So there's a lot more we could be doing.
They run sibling camps, sibling days, and just have them in groups, age focused, and just wonderful days where they can share those experiences. Yeah.
Well, thank you very much, everyone. I think we've actually hit morning tea time. I'm being asked to wrap it up. Are you sure?
It's actually for Danny. I remember your name correctly. Mate, you did so well speaking up there for starters. I'm sure your mum's like super proud. She hasn't stopped smiling. If you can really quickly answer, I suppose, because I think we're on a timer. What were some of the things that you remember you doing with your brother and sister when they're hospitalised to help keep them entertained? Because it's bored in there, but also maybe if you remember anything that, what was some of the things that your mum or your parents did to help make you feel included as the daily treatments or during the hospitalisations?
Often I would come and visit them. I would do some of the activities like the hospital school or Red Lollipop, I think it's called. And they would often tell me to join in with the physio just to get me involved with that. And yeah, they just wanted me to always be with them by their side. Yeah.
Great. Thank you so much, everyone. Morning tea will be served in the foyer just outside, and then we'll be continuing the concurrent sessions after morning tea. This room, P9 and 10, will be stream A, and P11 next door will be stream B, commencing at 10:55. Please refer to the conference app for details on each of the sessions, and I'd like to thank our morning tea sponsor, Trusted Care. Thanks very much, everyone.